Good afternoon, everyone, or at least those of you on this side of the Atlantic, and good morning to those of you on the other. So welcome to this webinar on improving health data, and specifically a mechanism for assessing data quality. I'm Ben Gordon. I'm the Executive Director of Hubs and Data Improvement at Health Data Research UK. And I lead our work on improving data. And with me on the panel, I have Trevor. So Trevor, I'll let you introduce yourself.
Yeah, my name's Trevor Heritage. I'm responsible for Inspirata's Cancer Informatics business unit. And it was my team that worked on this project, which Ben will briefly introduce.
Thanks, Trevor. So just in terms of housekeeping, this webinar is being recorded so that we can share the outputs of that and the recording for those who can't make it. We'll have time for questions later in the session, but throughout the discussion and the presentations, please feel free to submit your questions through the Q&A function in the meeting controls at the bottom, rather than feeling you need to wait till the end to submit those. We'll also be running a poll in the middle of the webinar itself and discussing the findings of that towards the end. So just briefly from me, for those of you who aren't familiar with us, HDR UK, Health Data Research UK, our mission is to unite the UK's health data to enable discoveries that improve people's lives. So we're the National Health Data Science Institute in the UK. We've been around for a few years now with a long-term vision about using large-scale data to improve people's lives through a number of different areas. And within that, we have a particular focus on sort of three strategy areas. So uniting the data, bringing it together, improving the data, making it more useful for researchers, and then supporting the actual use and application of data, so specific research projects. And all of that supported by a wide community, including our patient and public involvement and engagement, which is key to what we do. So this work focuses on improving health data. And as Trevor mentioned, it's something that we've been working with Inspirata on. And this comes down to one of the big challenges we face in improving data, which is trying to understand the characteristics of a data set and having ways of comparing that and communicating that. And so Trevor can talk in detail about the project we commissioned them to work on, and I'll discuss later in the session about some of the other work we're doing in improving data. So this is all visible and supported by the Innovation Gateway, which is an online platform supporting both the discovery and now the ability to request access to various health data sets across the UK. So the Gateway has almost 500 data sets on it from a whole range of different environments. It's been sort of codified and includes over 300 phenotypes from over 30 health data custodians across the UK. We've been working with those custodians to improve the data, to make it more accessible and useful, both in terms of work we've been doing on metadata, but also on characterizing data utility or the usefulness of a data set, which I'll touch on briefly at the end of the session. And then we've been supporting people to enable those discoveries. And a big area of focus, as you can imagine, over recent months has been on COVID-19. So we've been working closely with the UK government to provide insights from across the community on the progress and impact of that disease. So as mentioned at the start, we're now going to have a quick poll for our attendees to fill out. So it should be popping up on your screens any minute now.
Yep, it should be there for all attendees. So do have a read through and let us know your response.
Brilliant. Thanks, Clara. So I'll leave that up there for about 30, 60 seconds or so, just looking at what is it, where is it you're interested in using health data and understanding the usefulness of data sets comes from. And we'll play back the results at the end, just so you can see the sort of breakdown across the attendee list. So if you haven't completed the poll yet, it should still be up. But I'll pass now to Trevor to talk through your section.
Yep, thanks very much for the intro, Ben. As you're all continuing to make a judicious choice in the vote, I'll say a few words just about the project from an intro perspective. Obviously, as Ben said, HDR is working to really understand and improve the quality and utility of health data across the UK, and engaged Inspirata really to focus on defining how data quality should be assessed. Before I get into the gory details, next slide, Ben. Before I get into the gory details of the project itself, I wanted to say a few words about Inspirata, since many of you have probably not heard of us previously. So we are a healthcare informatics company. We're based in Tampa, Florida. That's where I'm based. Some of you might detect a little bit of a remaining UK accent, and that's because I grew up and was educated in England. But I've been here in the US for the past almost 30 years at this point. Anyway, so Inspirata is a company that offers a range of products for cancer reporting and registry, for clinical decision support, clinical trials matching, as well as general healthcare data analytics. Really, to do any of those things right, not only depends on having innovative algorithms and tools, and indeed we ourselves offer some of the best artificial intelligence and natural language processing tools, but getting good results from any of those tools and approaches really depends on having a rigorous approach to creating and delivering high quality data. In this project, we were asked to identify and compare open tools for assessing the quality of the data sets on HDR's Innovation Gateway. So Ben had mentioned earlier that there's close to 500 data sets on that gateway. When we did this work, there were originally a little over 400, and by the time we finished the work, around 450 data sets. So during this webinar, I'll walk you through the steps that we took to analyze the metadata around those data sets, how we identified and inventoried a set of open data quality and also data profiling tools, how we did the comparisons of those tools, and of course, I'll give you the final recommendations and conclusions from the study. Next slide, Ben. So before we start, you might ask the question of, why is this problem of data quality even a problem? And given that we're dealing with healthcare data, how much of a problem is it? And what's special about healthcare data relative to all of the other data sets and data types that you find in the world? So from my perspective, healthcare data is different and it is more challenging. And some of the reasons for that is really that the data itself is stored in multiple disparate locations and systems. It occurs in a huge number of diverse formats, from text, numerics, paper, digital, images, audio, video, all kinds of different formats. It's captured in inconsistent ways, ranging from discrete data, clinician notes, surgical and clinical reports of various types, with both structured and unstructured content within those various formats. And also the data is subjective. What's painful for me might not be painful for you. So if I'm a clinician documenting pain on the same person, I might categorize it as an 8 out of 10, and you might categorize it as a 5 out of 10. So how do you sort that differentiation out? Also, as you all know, there's a huge number of diverse clinical systems that support the day-to-day work of healthcare organizations. And getting a complete picture of a patient is really an amalgamation across those multiple systems, where each of those systems is itself capturing and managing the data in its own particular way. On top of that, you have complexity and diversity as a result of regulatory compliance, different coding standards, different reporting requirements for quality, readmissions, etc., as well as in our evolving digital world, increased complexity as a result of things like social determinants of health, predictive analytic models, as well as patient-reported and real-world data. So often you hear about big data tools and technologies, but in healthcare, I tend to think that we have really a much smaller but more complex, messy data problem that we're dealing with. Next slide, Ben. So before we begin to measure data quality, it's important to know, what do we mean by data quality and how are we going to measure it? I think data quality really consists of 3 aspects. The first is the metadata. So how well is the data set described? What is that data set? Where is it? What assumptions were made during its creation? Second aspect is, if you like, the intrinsic quality of the data. How good is that data for its particular intended purpose? And of course, in this webinar, we're going to talk about how you assess what good actually means and how you quantify that. And then lastly is the data utility side. So as Ben mentioned, the goal here is to publish data sets on the gateway and have them used by somebody else. So obviously your intended purpose could be very different from my intended purpose, and a data set that appears to be great for you may not be very good for me. So we have to sort that out. Next slide, Ben. So looking at the first one first, let's talk a little bit about the metadata and why we care about metadata. One of the things that I often say about data sets is they get gradually more useless the further they get from their creator. And the purpose of the metadata is to make that statement false, or hopefully make that statement a false one. So let's look at the metadata and different aspects of it from the user's point of view. the metadata lets me understand what the data set is, where it is, what it was intended for, and how I can gain access to it. From an organization's point of view, the metadata is actually preserving the value of that data set. It's removing the dependency on single members of your staff for the longevity and utility of that data set. And it's giving that data set a purpose perhaps beyond the one for which it was originally created. And then from the data custodian's perspective, the metadata is really focused around saving you as a custodian time, effort, and energy associated with managing and sharing those data sets. Next slide, Ben. So in our metadata analysis, we looked at the data sets that were published on the Innovation Gateway. We looked at them a couple of times. And we assess them in terms of the data, the type and the format of the data shown across the top of this figure here. And also in terms of the data model, how well that model is described and how accessible that model is to me. And we categorize the data sets accordingly, as you can see in the grid here, with the goal, obviously, to be in one of the green categories where you have a set of data in a consistent format, well described and accessible to me for whatever my downstream purpose is. We did our first analysis at the beginning of the project in April. We looked at 415 data sets. And disappointingly, I guess, only 24 of those data sets fell into the green category. And at the time, over 80% of the data sets were in one of the red categories. So not readily accessible or usable from the consumer's perspective. About 3 months later, and after a couple of turns on improving the metadata that Ben alluded to, we did the analysis again. By then, there were more data sets available on the gateway. And pleasingly, 110 of those data sets were now in the green category. And 60% of them remained in the poorly defined category. So overall, what this showed is that the effort put into the metadata in that 3-month time frame resulted in some very significant improvement in the quality and utility of those data sets. Still a way to go, but definitely moving in the right direction. Next slide, Ben. So now let's look at the data itself. And fortunately or unfortunately, depending how you look at it, there are many different ways and schema for defining what's meant by data quality. For the purposes of this project, we chose to use the DAMA quality dimensions of validity, accuracy, consistency, uniqueness, timeliness, and completeness. And the reason we chose those was really familiarity with that particular schema across the UK community. And as you can see from the bar chart on the left here, this is it's really your view of your organization's understanding and ability to measure each of those dimensions with your current capabilities and tooling. And unsurprisingly, accuracy is the one that's best understood and most easily measured. And also unsurprisingly, timeliness is one that's a little bit harder to embrace. Next slide, Ben. So one aspect of data quality that's important to bear in mind is that quality isn't something that you add at the end. It's often something that you measure at the end, but you don't just add it at the end and magically achieve quality. Quality is achieved at every step of your data collection, your data management, preparation, transformation, set of processes and tools. During this project, we examined a set of tools, each of which is good at some, but not necessarily all of this particular workflow. Next slide, Ben. So overall, we looked at somewhere around 30 open data quality tools in this project. These tools represent a mix of open source, open access, commercial tools that have free or community editions, as well as scripting and Python tools in there. And you can tell from some of the names that these are a little obscure Python type tools just by looking at this slide. We did not assess commercial tools because the intent has been to identify a set of tooling that could be used across the UK community in a straightforward fashion. While I'm here though, I do want to point out that while Inspirata is a commercial vendor in this field, and while we do leverage some of the tools that you see here, for the purposes of this project, we are an unbiased evaluator in the sense that we ourselves do not offer any of these tools or any competing products to them. Next slide, Ben. So our approach to the tools assessment has been to complete an inventory of all of the tools and assess those tools in terms of their capability in each data quality category. And the categories of data quality that we chose are those listed at the bottom of this slide. And those are actually defined as shown by the reference here in some of the Gartner tools assessment and quality reports. So with that, we further detailed out within each category a feature function tree, which you can see in the cutout here, detailing features and scope and capabilities that the tools should have in each of those specific categories. And what we did, as you can see from the spreadsheet there, is we scored each of the tools in each of the Gartner quality categories against each of the specific capabilities within those categories, and basically normalize those scores on a scale of 0 through 1, 1 being it's great at that particular task and 0 being it's not very good at that task. Next slide, Ben. The primary focus of the project, however, was not necessarily broad data quality tools, but really to focus in on data profiling. So we used the prior analysis to identify 8 tools shown across the top of this chart here that proved most capable for data profiling. And then we assessed each of those tools in detail relative to the DAMA quality dimensions, and in fact created a set of measures for each dimension against which we assess those tools. Our initial assessments have been performed using synthetic data sets. We had originally planned with HDR to use a suite of real data sets, but COVID intervened somewhat on that idea. So we used synthetic data sets, but then we validated our findings by working with members of the HDR community using their real data sets. In the end, the final recommendation that we have made is to use NIME plus Pandas profiling, or Orange plus Pandas profiling, and I'll talk a little bit about some of the reasoning behind those two selections. Next slide, Ben. So having said that we use synthetic data, it would be remiss not to describe a little bit how we approach the synthetic data creation. So what we did is we created synthetic data sets of 1,000 patient clinical data files, as well as a large data set of 1.3 million patient files. The latter obviously to assess the performance and scalability of the tools, and the former really to assess the capability in detail of those tools. To create the synthetic data sets, we use the open source tool Cynthia for the patient data generation, with White Rabbit and Rabbit in a Hat then to map that patient data into a standard OMOP model from which we did the rest of the analysis. Next slide. It went, and yeah, there we go. The data profiling itself is extremely flexible and insightful, giving comprehensive information for each individual variable within a data set. It gives insights to missing or inconsistent values, interactions and correlations within the data set, as well as an overall profiling from a content perspective of what's in that data set. So besides just looking at the capability of the data profiling tools, we were also looking at what kind of reporting and feedback do they give you. And the next step for this project and for HDR is to explore these visuals in a bit more detail, really to define those that make most sense to combine with data sets on the gateway. Next slide, Ben. I want to take a minute to thank the teams from Cystic Fibrosis Trust and also the Neonatal Medicine Research Group. These were the people that ventured into the beyond with us to take the tools that we were looking at and work through assessments of those tools using their own data. And the feedback at a high level on those tools is really that NIAM, which is obviously one of the tools that we chose, is an incredibly powerful tool set, very flexible and very complete in terms of its capability. But with that also comes a learning curve. And I think the cystic fibrosis team was a little challenged by the learning curve of that particular tool. And then the experience that the Neonatal Medicine Research Group had with the tools is that Orange is best used on Linux. Next slide, Ben. So while not specific to our project, it's a little remiss to talk about data quality without also mentioning the overall goal of reusing these data sets across the UK community. So in data quality, we've really focused a lot on the innate and the rational data quality. So how well is the data set modeled? How is it presented? And what's its conformance to standards? But when it comes to data utility, we also need to contemplate the extent to which the data set meets our new business needs. And also how accessible is that data set for my new business needs? Next slide, Ben. So in terms of data utility, and Ben mentioned this briefly, HDR is performing an exercise to really quantify data set utility, and that's shown in the lower left of this slide. I want to briefly touch on some extensions to that work that Inspirata has championed, whereby we assess each aspect of data quality and utility based on both the data as well as the metadata, and we give each dimension a classification: gold, silver, copper, bronze, whatever it is, in terms of its quality as a metric for data utility. And the value of this approach is not only is it giving you an assessment of the quality and the utility of the data, but if your data set, for example, falls into the silver class, it's giving you an indication of where the gaps are and what you might need to do to improve that data set and move it up to the gold or hopefully even the platinum class. Telling somebody that their data set is okay, but not great, is a useful thing perhaps, but telling them what they need to do to make it better is much more helpful. Next slide, Ben. So in terms of the final recommendations, and I've touched on a few of these as I've gone through the slides. Obviously, continued efforts to improve the metadata with continuous and ongoing assessment of that. As I mentioned, the application of the data profiling tools to each data set on the gateway and leveraging some of the visuals that I showed earlier, really to add additional insight to those data sets and what they might be useful for. As the experience showed from the HDR community that looked at some of these tools, while they're very capable of performing the tasks, the power and flexibility really suggests looking at perhaps creating some standard data profiling pipelines that can be applied across the community and across the innovation gateway, because otherwise you run the risk that everybody will create their own pipeline and measure data quality their own particular way, and then of course you won't be any further advanced. And then of course, as we've mentioned, really thinking about the downstream uses that a given data set might have and assessing the quality of that data set with those use cases in mind. Next slide, Ben. So last but not least, I want to thank Caroline Cake and also Ben for sponsoring this particular project. I want to thank my own team at Inspirata, with particular thanks to Richard Jeffrey. And most of all, I want to thank Ine McConaughey and her team for the amazing technical work that they've done throughout this project. I also want to mention that if any of you dream up a deeply technical question, then Ine has joined us as a panelist and will no doubt be overjoyed to help me answer that particular question. I also want to thank the project team members from HDR, and in particular Neil Sabir and Sushil Varma for their detailed technical inputs and insights throughout this project. With that, I will hand back to you, Ben.
Brilliant. Thanks, Trevor. And through the magic of Zoom, I believe we're just about to see the results from the poll that we put up earlier in the session. But certainly looks like population health coming in quite high. And then similarly, just behind it, public health. So I guess presumably a lot of overlap from the attendees there. It'd be interesting to do a bit of segmentation actually across our various audience members, but I don't think we've got got the level of detail on that. But I would expect, looking at the top ones there, the population health, public health, and real world data, I'd expect lots of overlaps in that there. And that real world evidence, I think, is one that particularly benefits from a focus on data quality and improving data, particularly things like extracts from electronic health records and what we sometimes call secondary use data. So data that's collected for clinical purposes and then later used for research often has kind of, in some cases, quite patchy quality. Trevor, any reflections on the poll results?
Well, you picked up already at the end there, Ben, the real world data and evidence, and obviously with a lot of the data sets on the innovation gateway coming from NHS trusts and healthcare entities of various types, I think you're starting to see strong interest in trying to mine those data sets for that real world evidence and point of care information.
So just before we go into the questions, and it's great to see some of the questions coming through the chat already. So kind of what happens next with this. So we've talked a little bit about the many different projects we have across the HCR UK community on improving data. And one that will be the subject of a future webinar is our work on the data utility matrix. So providing that means of communicating whether a data set is fit for a specific purpose. And that actually comes on to Emmanuel's question in the Q&A, which we'll get onto in a second. But yeah, you can see just there a whole range of the different activities we're doing across our health data research hubs, our national priority research projects, the Health Data Research Alliance, and beyond. So there's more details on our website, and please get in touch if you want to know more. So onto the questions. This is where I'm just trying to juggle my chat and the Q&A box. So just starting with Manuel, your question then is about actually the fact that, particularly for imaging data sets, something that may be useful or may be seen as high quality for one particular purpose is you would not be kind of sufficient quality for another purpose. And that's a challenge that we've aimed to address with our data utility framework. So that's, like I said, we can and will do a whole webinar on that. But just to give you a quick overview, that's the aim of that is to communicate in advance. So before someone's requested access to the data, which can sometimes be quite a lengthy process, whether it will meet their specific needs. You mentioned imaging in particular, which I think is an area that will take more development in the framework itself. Currently, it is quite generalizable, but I think imaging has some particular challenges. Trevor, anything? Sorry, go ahead.
Yeah, so obviously the focus of this project was assessing the quality of data sets that are currently posted to the HDR gateway. And obviously the preponderance of those data sets tends to be more tabular data, or data that you can get into a tabular numeric text type format. With respect to images, a lot of the work done here is still very relevant to image-based data sets. So for a start, the metadata around those data sets is going to be important. Secondly, some of the tool sets that we looked at, NIME, for example, has specific image analysis and metadata extraction capabilities within that tool set. So you could actually use NIME to extract information about the images that pertains to the quality, and then bring that information back into this overall framework.
Thanks, Trevor. I think we've answered, so Pierce asked a question about whether this work on the tools will help with the assessment of data quality of medical images. I think we've covered that a little bit. It's something we're exploring through the utility framework project. I don't think a lot of the profiling work would have the same level of application to imaging, other than perhaps some of the accompanying information and imaging metadata. We had a question from Matthew on examples where data quality improvement has led to measurable improved patient outcomes. I think it's kind of quite varied, and the improvement, data quality improvement, can cover a lot of different areas. One example I would use is some work from recent work from University Hospitals Birmingham and University College London Hospital, looking at progress of COVID-19. So the work that the teams did across those two hospitals, sort of linking and comparing data, and a big part of that involved improvements to how the data were structured and presented, then allowed more directed clinical interventions to take place in those hospitals. Trevor, anything to comment or add to that one?
Well, when you were talking, I was thinking about, the fact that I think in most healthcare organizations, data is rarely just plucked out of the EMR or pathology limb system and used directly without some level of curation applied to it, whether that's applied by registrars or by researchers or analysts that are working with that particular data. So I think there's a ton of examples of this kind of work just happening on a day-to-day basis to improve specific data points, if you like, that are used day-to-day in care. I'm not necessarily aware of an initiative that's been done en masse like this to take a nation's data sets and improve them from an overall quality and utility perspective, which is actually what makes this so exciting and interesting, right?
Absolutely. So I'm conscious that we've hit the end of our allotted time. I'm very happy to keep answering questions, but what I might do is just focus on two that may be good for either you or Ine. Just before I do that, for those of you that have to leave and can't stay for the further questions, we'll be aiming to publish the outputs of this. So we'll provide a follow-up to the registration list from this webinar once that's been done. And we'll also cover our utility matrix in a coming webinar. And if you've opted in to receive communications from HCR UK on relevant work, then we'll be contacting you about that, because quite a few of the questions in the Q&A are covered in that. So if you have to leave, we won't hold that against you, but I'll stick around and answer a few more questions Hopefully Trevor can as well. There's a question here on advantage to using the tools mentioned compared to sort of experienced, knowledgeable user using R or Python themselves. So what are your thoughts on that, Trevor or Ine?
Well, maybe I'll speak first, and then Ine might have some additional thoughts. So I think that any data quality study is much more informative if it's performed by somebody who has good subject matter expertise around that data set. So, you know, whether you're using R or something else versus the tools here, your knowledge of that data set is going to be pivotal in terms of the ultimate quality of that data set, how you describe it, and how you create it. Ine, do you have anything that you might want to add?
Sure. I mean, usually when you're looking at data quality and you have a few people that are contributing to that data quality, and absolutely would want to use your data scientists who probably know and love Pandas and know and love Python. However, when you're looking at an enterprise scale assessment of quality, you probably want to have good workflow and orchestration. And you want to be able to have something that can really scale and address multiple factors. And I think that's where NIME comes into it.
I'm on mute. Sorry, there was another question for you, I think in the chat, about why, your thoughts on why using a kind of common data model is better than a non-standard model, particularly, you know, translating to the OMOP CDM, you lose some of the situation-specific granularity. So thoughts on advantages of that versus non-standard approaches?
So my initial comment, and Ine can elaborate, is we didn't necessarily favor a common model over a non-standard model. What's favored in the analysis is that if you're using a non-standard model, that you describe it well so it's accessible to somebody else. Maybe that wasn't entirely visible from the slide that I had, but the focus was less on whether it's standard or non-standard and more how well described that model is. Ine, anything that you want to add?
Yeah, sure. So I agree that a common data model in your actual store should be something that is flexible and adaptable to the different applications that you want to apply to it. However, when we're talking about data reuse and sharing, I think it is very important that that model can be translated to something that is standard-based, like FHIR.
Right, so we're doing some work at the minute on looking at standards nationally, not necessarily to provide any recommendations, but just to gather some information on the current approach across the UK. And I suppose one of my views would be that it's less about recommending a particular data model or standard, and more about providing clarity on what model is being used. So making sure it's supported with data dictionaries and ideally maps for comparing between various data sets. I would invite, and Neil Sabir, our Chief Data Officer, is in the attendee list. I've been trying to get him on to give his views, because I know it's an area he's particularly passionate about, but Neil, I can't seem to let you speak. But I'm sure you could put some questions in or comments in the chat.
He has been.
Good to have you with us. So I think a few of the questions that have come through on the Q&A about work that HCR UK is doing to provide guidelines and data quality measures, and the question about how we decouple sort of general quality of data from the purpose for which it's to be used. I think those are the objectives of our utility framework, so we can pick that up through that webinar. There was a question from Tom on a standard for what's considered research-ready data. And I would say no, because research is a very, very broad term. And so ultimately the requirement is in the eye of the user. So I wouldn't say there's a particular minimum expectation there.
I was going to say one comment to that is, you know, we have the data utility matrix with the gold, silver, copper, bronze categorization of data sets, and you might want to, you know, think within that set that reaching a certain point gives you research grade data set, but not necessarily a data set that you could publish more broadly than outside of a group of researchers that's focused on that area.
Thanks. Question from Neil Walker about and is it HCR UK's role to offer skills and engineering help? So we have plans to build a data engineering capability within HCR UK, but also our work in the training space aims to support our partners and organisations across the UK in increasing skills and supporting the development of staff in that area. So it's a kind of internal and external approach. Question from Manuel about definition of quality addresses good practice for preparing complete, accurate data sets, but also concerned with quality as a property of individual data items. So sharpness of images, accuracy of measurements. Yes, I mean, that's absolutely important, and depending on uses, people will have particular needs in that area. I think it's certainly something we'd want to build on and work towards. Just conscious we need to kind of progress through it. So looking at a data set level and then down to a data item level.
I was just going to say that the analysis that we did is actually looking at the data items rather than the data set as a whole. You know, as I mentioned to an earlier question, you know, certainly if the data set is based on imaging data, yeah, in this particular study, we didn't delve into extracting information about the sharpness or quality of images, but you could certainly use the tooling that we've identified to discern certain information about those images that you could roll up into the overall quality analysis.
Thanks. Follow-up question from Amy, I think relating to the question earlier about HCR UK doing work on ranking quality and next steps for improving. So the aim through our data utility matrix work is to present that on the gateway itself. So when looking at a data set, you'd be able to see where it kind of fits across the spectrum. and given the kind of criteria within the matrix, that allows the kind of data owners themselves to work on improving in the particular dimensions. With the kind of specific focus of the tools, Trevor and I could talk more about this. We deliberately didn't focus on tools that would support people in improving data. You know, it was purely a kind of profiling function, but some of the tools reviewed to support that activity as well.
Yeah, I was going to say that while for the in-depth part of the study, we didn't focus on the overall data quality creation process. The initial inventory and assessment of tools that I talked about did cover those aspects, you know, from source through ingestion and preparation of the data. So HDR at this point has a data asset from us, which is the inventory of those tools and the assessment of those tools in terms of their capability for creating different aspects of quality and throughout that overall quality process. So that's information that HDR has, well, I'm sure it's up to Ben how that information would be disseminated across the community.
Yeah, and we're something I should have mentioned at the start. We're making the content of the Inspirata work, so the information about each of those tools, available on the gateway, so they'll be searchable and all uploaded through that. Then the last question again is going to get the stock answer about, so how do you rank data into the different categories, platinum, gold, etc.? Are there resources and guidelines for doing that? So we're currently preparing to publish our work on the data utility matrix, and that there's some information on our website about that at the minute, and there'll be more both in the publication when that's ready and in the upcoming data utility webinar, which currently we don't have a date fixed for, but we're expecting to do that in mid to late October. So with that, we're neatly at 5 p.m. So thank you very much for taking the time to listen to us. Thanks for a great list of kind of thoughtful questions, and look forward to hearing from you about how we can continue to use this and refine our approach. So thanks from me and from Trevor as well.
And thanks from me also. I really appreciate the audience here and the insightful questions, and happy to connect with any of you via email or other mechanisms to explore ideas and thoughts in more detail.
Great. Thanks a lot. Bye-bye.
Bye-bye.